We go now to Laura Windsor, our reporter, with some important information about epilepsy.
Epilepsy is what happens when the electrical activity of the brain goes out of control, resulting in seizures. Ongoing research promises a life free of such seizures, in some cases without the need of surgery. Dr. Richard Kim of Hoag Memorial Hospital Presbyterian talks about the treatment of epilepsy and its future.
Epilepsy refers to the tendency of a person to have repeated seizures. So in the strictest sense, anyone who has 2 or more seizures has epilepsy. Seizures themselves are an electrical discharge of the brain, and they may be localized to one area of the brain, or they may involve the entire brain. And seizures can have a variety of manifestations, all the way to the so-called grand mal seizure or convulsive seizure, where a person falls down and their whole body shakes and they froth at the mouth. But there can be very subtle seizures too. In some cases, epilepsy can be preventable. In many cases, it can be treated, and in some cases, it can be cured. There are a whole multitude of different types of problems that can cause seizures, all the way from acquired lesions of the brain, like brain tumors, vascular malformations or stroke, inborn malformations, and even trauma.
What are the symptoms of epilepsy?
Epilepsy itself is really a symptom of an underlying tendency of the brain to have seizures. And that may be because of a genetic predisposition, it may be because of a malformation of the brain, or acquired conditions of the brain. So there are a wide range of conditions of the brain that can cause seizures. And so seizures and epilepsy really are a symptom of some underlying problem. And that's what we try to get at, is we try to find out what the underlying problem is.
Dr. Kim describes how epilepsy is diagnosed.
We start from the beginning with a complete history, physical exam, usually an MRI scan, high-resolution MRI, EEGs, sometimes functional testing too, such as PET scanning and functional MRI. And all of that is meant to first establish the diagnosis as well as establish the underlying cause of the epilepsy.
What are the treatments for epilepsy?
The mainstay of treatment is medications, and medications can control epilepsy in the majority of cases. About 30% of cases, medications are not effective, and that's when we start to think about more aggressive treatment.
How can epilepsy be cured?
Medications can suppress the seizures. The only true cure for epilepsy is surgery. If the source of the seizures can be removed and the seizures stop, then that's a cure.
What do you see in the future treatment of epilepsy?
We're sort of on a threshold right now of some very exciting new potential treatments for epilepsy. Much less invasive than we do now, where we open up the head and cut out the offending brain tissue. There is a possibility for deep brain stimulation through a thin wire. There's a possibility of delivering anti-epileptic medications directly to the brain through a thin catheter. There is the possibility of computer chips implanted into the patient that can sense when a seizure is going to happen, and then sending an electrical signal to that part of the brain to make it stop before it starts.
Knowing the symptoms of epilepsy is the first step in seeking immediate medical attention. For the American Health Journal, I'm Laura Windsor.